mentioned are not true medical organizations. They're meant to be smoke and mirrors, to obscure the facts, to keep this $30 billion a year industry growing at your expense, your financial expense and your health expense. So I would urge you, please tune in next week. And if you have a chance to get the book, read the book, Do You Believe in Magic by Dr. Paul Offit, O-F-F-I-T. You can get it at the New York City Public Library or probably your local library. It's a fantastic book, and it may save your life. So thank you very much, Gary, for calling, and please tune in next week to the show because I really want you to listen to Dr. Paul Offit. Thank you. And Michael from Woodside.
Doctor, first of all, I want to say you should be teaching as well as working in the clinic because you have just a wealth of information, okay?
Thank you very much for your compliment. I am teaching. We have tens of thousands of listeners on WOR. We have 2 shows every Sunday and 1 on ABC. And the whole point of this is not to give hokum pokum, but to show facts and to tell facts. There's facts for almost everything out there. And there's facts for vitamin C and all this malarkey. And you'll see that it's malarkey, and people should know it because they're spending oodles, and they're damaging their health while they do it.
Okay, my question is 54-year-old female with 1 kidney removed, currently has cancer in the remaining kidney, had been treated with radiation for the last 3 years on and off. Can this radiotactic surgery, your procedure be effective for someone who's been through the mill?
Well, a great question. We were the first in America, the first in Western Hemisphere to perform stereotactic body radiosurgery. We've been at it for many years. Kidney cancer, along with sarcoma and melanoma, were always said to be radio-resistant, and that was because people gave a little dose. And then we brought this technology to America from Sweden. We started treating kidney cancer. And unbelievably, and it wasn't just that, we were treating kidney cancer that spread to the brain years before with radiosurgery. And the success rate, meaning stopping, shrinking, or making that cancer go away, is about 90% for kidney cancer. So we've treated it in the kidney, we've treated it in the lymph nodes, we've treated it in the brain, the lungs, you name it. I'm going to talk about a patient if I get to tonight. Others, I'll speak about that patient next week who had a massive kidney cancer, lost his job with New York City, and then found he had cancer afterwards. So, yes, radiosurgery makes sense.
And last question is the concept of the electronic cigarette, the so-called vaping or vaporizing. Any connection with cancer yet, or what's your feeling on
Not that we know of yet. It hasn't been studied enough.
Right. Thank you very much, Doctor.
God bless you, and thank you, and wish you well. We have Dr. Eisen on the line. Dr. Eisen is a Argentinian-born radiation oncologist, fluent Spanish speaker, and his goal is to treat Spanish-speaking New Yorkers, Americans, and others with cancer in their native language. So good evening, Dr. Eisen.
Good evening, Dr. Lederman. I just want to say that I just saw a patient last week that she had a breast mass and for 2 years, and she was listening to your program. And actually, that makes for her the difference because she decided to come to our center because she was terrified with the mass and she didn't want to see anybody until she heard you on the radio. So I would like to thank you for your service because actually, if it wasn't for you, I don't think that this patient was going to pursue it. Because, as you know, breast cancer sometimes, and we see it often, that the patient waits, and sometimes you see a patient in the emergency room with the whole area with cancer. So thank you for...
Well, thank you for your thank you, but I would tell you, just let's use that as a reminder. Number one, women with lumps in the breast, please come. To spend years wishing it to go away is not going to do the job. So please come in. You can get a little biopsy. It's like a little pinprick. You don't feel a thing. You can get a mammogram and a PET scan all done in a day. In a day, you'll know everything about it, whether it's cancer or not, and whether it needs treatment or not. So please don't stay home and hide. That's not helping you. Please come in, and you'll see other women like you. You You can talk to them, and they can tell you what their experience is, but I urge you to come in. Dr. Eisen, you have a Spanish phone number for patients who want to contact you day or night?
If a patient wants to talk to me, I will be very happy to talk to the patient in Spanish.
Okay, what's your number? What's your number?
My number is 917-836-8105, and in Spanish is 917-836-8105.
And you're available day or night for the patients?
24/7, and I really enjoy, and they spend a lot of time with us.
What's the number again in English?
In English, is 917-836-8105.
Okay, we're going to go. Thank you very much, Dr. Eisen. We're going to go to our sponsor once more, and then we'll be back with some more cases and some more calls. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212 Choices. 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212 Choices. 212 Choices for Radiosurgery New York.
News Talk Radio 710 WOR.
At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212 Choices, 212 Choices for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212 Choices, 212 Choices. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Thanks, Rob. Thanks, Ariel. We have Jackie on the line from Brooklyn with tinnitus and vertigo. Good evening, Jacqueline.
Hello, Dr. Lederman. I am very glad to hear you on the radio, and what piqued my curiosity and what encouraged me to call was your explaining what acoustic neuromas are.
Yes.
From your commercials that I've heard previously, I thought that you only dealt with cancer and its treatment, but I happen to have tinnitus, and I had also had vertigo. I've had a brain scan done, but when you explained what the acoustic neuromas could be, and we're talking about the ear canal and having an MRI with contrast, I had a brain scan, but it wasn't with a contrast.
Then it's useless.
Yeah.
And I can tell you, I just had a patient who took care of her father, and she came in with unilateral hearing loss, and I got a brain MRI with contrast. And it turned out she had a brain MRI 3 years before, and it wasn't seen by the doctors. We went back and we saw it, and it had increased in size substantially. So unless you get a brain MRI with contrast, you will not see it. You have to order the right test, or it's going to be useless. So you could be falsely reassured, which is disaster.
Well, I had no reassurance because I've been to numerous ENT doctors. I saw a neurologist who recommended the MRI, which I had done. I don't have the report in front of me. I don't have it handy, but there were infarctions on there. He said, well, you're too young. You couldn't possibly have had all of these strokes.
Okay, well, let me tell you something. We're running out of time. What I urge you to do, call me, and any listener who wants can call me during the week or any time pretty much they want, 212-CHOICES, and we can speak about what to do, and we can speak about how to remedy the situation and try to get you on the right track. So it's 212-246-4237, 212-246-4237. During the week or nights or holidays, I try to answer my phone and that of the department. So please give us a call, then we'll try to take care of it. We only have a couple more minutes. I just want to talk about a couple cases. I promised to talk about one patient who's a very nice gentleman. He was feeling lousy. He worked for the city of New York for 30 years. He lost his job because he was feeling lousy, couldn't work. And unfortunately, he went to the doctor after he got fired, and he was found to have a massive kidney cancer. So this is in reference to the patient who just called with kidney cancer. He had a massive kidney cancer on the right, wrapped around the artery of the right and the left, the inferior vena cava, which is the main blood vessel to the heart, and the aorta from the heart. And he had no chance for treatment. It's a really sad case. And we're working on getting him insurance, getting him treatment. Again, for kidney cancer, where we aim to beam, the success rate for all our patients is over 90%. So it's quite high, even though, unfortunately, most doctors will wrongly tell you that radiation doesn't work. Standard radiation doesn't work. And that's why we often offer a second chance, even if standard radiation, standard chemo, or surgery didn't work. So it's very important to know that there are often second choices. It's obviously better to make your first choice good, perfect. But even if, and some people we can't go back in time, to think about a second chance and give us a call. I also want to talk about a patient from Maine who called in with glioblastoma, got radiation and Temodar, which is usual treatment. The brain cancer glioblastoma returned. There's 2 foci in the brain. I'm talking to you, Mrs., about your family member, your father with glioblastoma, and they're just increasing the dose of Temodar, and it's doing no good. And actually, we have a whole program using fractionated radiosurgery for the brain to treat glioblastomas. On average, we believe, increase the lifespan of the patient with recurrent glioblastomas. And 2 more patients I want to talk about from overseas. One who had gamma knife in Italy for acoustic neuroma, and the tumor grew. And one patient for acoustic neuroma had CyberKnife. Again, these people are going for the latest, greatest treatment. And the patient was left with trigeminal neuralgia. Trigeminal neuralgia is a complication, usually when the dose is too high. We almost never see it, but we've seen multiple cases from here and overseas with CyberKnife. Don't go for the latest, greatest treatment because it's probably only the latest and not the greatest. And there's a study, which we'll talk about next week, showing that almost half the time the latest treatment is less good than the treatment that exists. Ariel, what do you have to say about that?
New is not always better.
And new is not always better. Why is that?
The old treatment has been tested. You know it's working. Hopefully you know it's working.